Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamualaikum. Ji ayanu, pakhair agale, ni hao, chunashumme, washmale. Ohai gozaima's, guten Morgen, hola, bonjour, privyet, kaifa hal? Haleshima chatore, ahlan wasal, marhaba, buna, mucho, gracias, swabi, abhalli kare aaya. Hoş geldin, and I sayo kuya mora chi vatto chi hajat kalimera, and a very warm welcome to everybody who's tuned in to PTV World and are watching World this morning. Alongside my very well learned colleague who happens to be Miss Hajar Sati. I happen to be Shahzad Hassan Khan, and we hope and pray that everybody out there is doing wonderfully well and that you're ready to kickstart your day with us. But first things first, hello Hajar, assalamu alaikum. How are you feeling today?
Walaikum assalam. Thank you so much for introducing me, Shahzad. Certainly the weather is getting finer, but I think there is one aspect that I'm constantly noticing about weather. That is that the humidity level has spiked a little bit, right? No matter how much cool and windy breeze is blowing, you will still feel the perspiration, you will still feel the sweat coming on, and this is very abnormal, right? Because we didn't used to expect this weather, especially after the monsoon is gone. And certainly my mother was complaining yesterday that, oh my God, there's so much wind blowing, but still I feel the hotness and sweatiness and perspiration. I don't know why. And it said, I told her that it's not just you. I mean, I feel the same way about it.
And I actually got a little worried, you know, so just yesterday, because I wasn't getting a lot of time to spend at the gym, and just yesterday we did had an Asia Cup cricket match.
Okay.
So I took my sweet time of being in the gym, and while I was at the gym, I was like, yeah, I think there's something wrong with my lungs, you know, why can't I breathe? You know, and then even eventually today, I was like, yeah, I think I need to go to the doctor. Let me get myself checked up. So thank you so much for saying that.
No,
because that means that I'm certainly okay. Right. But for everybody who's out there, ladies and gentlemen, please make sure that you kind of keep yourself hydrated. It's still hot. And yes, you know, because somewhere in between, you go out on your terrace, you know, somewhere midnight, you're like, okay, yeah, the weather's changing.
True.
And then, you know, after another day, you know, you go out on the terrace, you're like, yeah, it's still so warm, let's go back inside.
Right.
So it's really confusing for people out there whether what's happening, but we're certainly eyeing on to winters now. It's mid-September, Hajra, and somewhere back like 5-6 years ago, mid-September, the weather used to be like
very
perfect t-shirt weather. True. And that's something which we are missing out on, but we'll certainly talk more about it in our coming shows as well. But time now for top stories. So let's see what do we have happening inside the country and all over the globe.
Right. So, Chief of the Army Staff, General Syed Asim Munir held a meeting with the President Rajab Tayyip Erdogan during an official visit to Turkey. According to ISPR, the visit is a part of the high-level mutual visit by both the brotherly countries to enhance the historic, diplomatic and military ties. During the visit, Army Chief called on foreign and defense ministers, commander of the Turkish General Staff and commanders of Turkish land and air forces. He emphasized on enhancing defense collaboration and training cooperation, and I think that's generally a very good sign that we have such sort of military to military ties. And I can recall in the past that Turkey has also helped us in the construction of the Navy corvettes back in there, and made sure that we are pro and going on towards the self-sustainability and indigenization schemes inside the Pakistan.
Exactly, and you know, this made this brotherly relation kind of build up because, you know, just I think it was a few months ago that there was a very destructive earthquake in Turkey, and you know, the forces actually went from there here, the rescue forces, and made sure that they're going to contribute in all facets of life. So made this relationship live longer. Now moving on towards sports, where my favorite cricket is up, ladies and gentlemen, as the Pakistan and Sri Lanka will face off today in crucial match of the Super 4 stage of the Asia Cup 2023. Both teams have 2 points each, so the winner will qualify for the final. PTV Sports HD is telecasting the entire event live from Colombo. In case the match is affected by rain, both teams will receive 1 point each, and Sri Lanka will advance to the final due to a better run rate. That's what I was worried about. India has already secured a place in the final by defeating Sri Lanka earlier. Now, for everybody who's thinking that how Sri Lanka will be able to make their way towards the final if in case it rains today, ladies and gentlemen, it's because of the fact that, first of all, Pakistan lost from India by a very bigger margin, which was 228 runs, and historically it happens to be the biggest margin ever. And then so the net run rate actually kind of fell down to minus 1.0 something, and which is why now again, you know, India was able to kind of succeed their place because they defeated Sri Lanka by 41 runs. And so today it's more of a semi-final for Pakistan. It's do or die. Sri Lanka, you know, they're going to be there even if it rains. and even if they win. But if it rains, Pakistan unfortunately won't have a chance to go to the final of Asia Cup, and we'll be sad because Pakistan happens to be the host of Asia Cup's 16th edition, taking place in Colombo as of now.
Right, and Shahzad, there's this one thing that is bugging my mind, and I wanted to ask you, since
Sure.
you are very well versed with the matters of cricket. So, if there is constantly rain predictions, and we've seen that how rain has disrupted matches before, why did they select the venue in Sri Lanka if they already knew that?
All right, so Haja, you know, it's more of a controversial question, you know, rather than being a very simple question. So the thing is that the ACC decides, the Asian Cricket Council decides.
Okay.
So what happened was that because Pakistan had the rights, which is why we did see that, you know, there were matches which took place in Multan and Lahore. So the first 4 matches, I think, in between took place over here in Pakistan, and the Team India from BCCI, obviously the Indian Cricket Board, didn't really allow Team India to come down to Pakistan to play because of whatever security threats, which I still do not agree, and I don't think that sports really need to be politicized as well. And then because the ACC is actually headed by an Indian individual whose name is Jay Shah. So Jay Shah thought that, okay, you know, it's best to go to Sri Lanka. But rather, I think that a better venue could have been UAE or Dubai. And well, that certainly didn't happen. And I think that our board certainly needs to think about it as well, because, you know, they should have said that, okay, why not Dubai or why not UAE, where at least it's not raining.
It's not raining, and obviously the match is not disrupted. So now coming to our segment, which is about the Blood Cancer Awareness Month. September is considered and observed as the Blood Cancer Awareness Month, and there are some statistics that I would like to share. That it is the 3rd biggest cancer killer, and it's a hidden cancer. It stealthily penetrates your body, and we need to have more such discussion about whether it can turn into deadly or terminal disease, or if there is a cure available and how we can cure that. So without any further ado,
before we actually introduce our worthy guest over here, I would like to speak about it. And it's because of the fact that, you know, because when we say it on television that, okay, you know, we need to figure it out, people actually get scared. You know, people who unfortunately are suffering from this illness, they do get scared that, okay, I don't know what's going to happen next. So ladies and gentlemen, you know, we do not live in that age where the treatment is not available.
Cancer is very scary in the first place,
this is how they portray it on television. So what I need to tell you is that, first of all, please make sure that you do know that all sorts of treatments are available. And that this one is a treatable cancer. Now, obviously, we do have experts over here, and they're going to share their insight on this. Earlier, there were days when the only solution was the bone marrow transplant, but now we do have medicines which can actually not cure, but rather control the disease for you. And we are still on trials that the medicine might probably be a one solution or a one window solution for people who are actually suffering from blood cancers. So without any further ado, I think we have an expert over here, so we would want her to kind of share her insight on this, because I happen to be one of the survivors. Alhamdulillah, I thank Allah Almighty for that. And the sole reason, before introducing the guest, I'm saying is that one of my amazing doctors happens to be somebody, you know, whose name is Dr. Colonel Salim Siddiqui. He's at Shifa Hospital, and they have one of the best oncology centers as well. So without any further ado, we're very lucky that we have been joined by a consultant clinical hematologist oncologist. She happens to be Dr. Aisha Iftikhar. Hello, madam. Assalamu alaikum. Good morning. How are you feeling today?
Walaikum assalam. Thank you so much for inviting me on the show. I'm doing good.
It's wonderful to have you over here.
Wonderful, and certainly we are really honored that you came here. So, Dr. Aisha, let's kickstart the conversation. It's the Blood Cancer Awareness Month. What are the symptoms? Because as we were researching about it, and as a layman, we came to know that it's a very stealthy sort of a disease, and it silently penetrates inside. So, how can one detect the cancer in the first place?
Okay, so talking about blood cancer specifically, yes, patients come with different vague symptoms. Unlike other solid tumors like breast cancer and liver cancer, usually the blood cancer patient, you know, they have a history of few weeks or say few months, not more than that. And even for family, it is shocking when we tell them, you know, you are suffering from this disease because the person is otherwise healthy. So mostly you're having low-grade fever, excessive sweating, bleeding from, gums and tooth and GI tract, and, you know, undocumented weight loss. You know, families, patients usually complain they're just losing unintentional weight loss. They're not dieting and they're losing weight. So, you know, don't take these symptoms lightly.
Lack of hunger as well.
Loss of appetite, you know, and generally, you know, there are a lot of blood cancer that usually come with abdominal distension because spleen becomes large. So they would come up into gastro-OPD, you know, with abdominal distension because they're not sure what's happening. And when you do a blood test, it turns out, you know, they are either having blood cancer, leukemia or lymphoma.
And usually what happens is that whenever you go for a CBC diff, that's what they call the test complete blood
Yes,
picture.
exactly.
It would actually say, blast crisis or something. I think that's what's written in the report. So now what we really need to talk about over here is that, there are multiple types of blood cancers.
Exactly.
So the one, I have read about, because I was going through it myself, was that, that the 9th and the 22nd chromosome overlaps, and, unfortunately,
Exactly.
there are a lot of white blood cells immature, which your body starts to produce, and hence resulting in lower immune as well. So now let's talk about what other type of blood cancers are there, and do you think that they have similar treatments and whatnot? So let's first talk about the other
Okay,
types.
so coming to blood cancer, what is blood cancer first? Blood cancer is basically uncontrolled production of cells of any lineage, either it's white cells or the, right? So whenever you have an uncontrolled cell production, you would end up having a high count. So a lot of patients present, so we have broad categories. We have acute leukemias, and then you have chronic leukemias, and then there's another group known as lymphomas.
Yep.
So they all are different types of blood cancers. So in acute leukemias, patient can come with bleeding, fever, with low blood counts, with low platelet counts. And usually the CBC, tells you when you have an abnormal CBC and you see blast cells, that is acute leukemia. In lymphoma, unfortunately, it's not necessarily you would have a CBC which is abnormal.
Okay.
You might just come with lymph node swellings. You have a cervical swelling, you have an axillary swelling, or you just having abdominal distension. I had a patient who actually presented, she had a 6-month pain in her arms. She just got a routine checkup. They found out, okay, there's a blood clot in her, cervical region. So, she started on a blood thinner. So her physician advised, since you have a blood clot, you're a young patient, why don't you get your CT scan done? And she just got her CT scan done. She was asymptomatic. She had no other symptoms at all except a radiating left arm pain. So she found out she had a huge mass in mediastinum. So right above the heart, there was a huge mass. And that is when her workup started. We got her biopsy done, and turned out she had a lymphoma. So, the family was shocked. It was shocking for the patient. She's a young lady with small children and everything. So generally, this is what I'm trying to tell the patient with lymphomas and leukemias, they do not have a very long history.
True.
They would probably come with a 3-month history, 6-month history, that would be it. And with very vague symptoms.
But we have still been unable to identify the very reason of these blood cancers. So imagine that every single time that I've been to a physician, or anybody who's been to a physician, I think that the first question anybody is going to ask when the diagnosis is being done, that said, what is the cause? So number one, they would say that, okay, do you remember that somebody else had it in the family? Number
exactly,
one.
family history is very, very important.
Exactly, and we do not have it over here. So imagine that, I might know about, unfortunately, if my father had any sort of illnesses, but, we are not sure whether our grandfather had it or not, because we didn't have such advanced technology. But do you think that medical science still till date has been able to figure out that what can be the reasons of blood cancers?
Okay, so with blood cancer, genetic predisposition is very important.
Okay.
We do ask a family history. We have blood tests which actually identify genetic mutations available. So we have a lot of genetic mutation tests available in Pakistan as well. So one thing, when we have children coming 1 year, 2 years, obviously, family history is very important in that case. Other than that, obviously, there are a lot of researches going on exactly to identify the reasons of this genetic mutation. One reason is a lot of intermarriages in, Pakistan, India, and subcontinent.
Okay.
We have a lot of intermarriages. So, most of the family members, when you have one patient of cancer, it turns out there are other members in the same family, far-fetched, and, So one thing is genetic. Other thing is probably, the diet probably we are taking.
Lifestyle?
The lifestyle we have. We don't have a healthy lifestyle. Neither of our kids are taking healthy food.
True.
So being a mother of 3 children myself, I have to struggle to make sure my children are not taking a lot of junk food.
Yep.
So I think there's an overall decline in the lifestyle and our eating habits as well.
True.
Most of the things we're eating, they're not pure. Either they have urea in it, even the milk that we get is not pure.
That's true.
So, all these things are carcinogenic.
True.
Smoking, tobacco, alcohol, diet adulteration, these preserved foods. So these all are hazardous to health because they all are carcinogenic in long term. They do lead to mutation even if you do not have a family history. Remember, when you're exposed to these things, they would in long term cause mutation in your body.
Right,
No,
right.
That would
that's one
predispose
way to
you to
look at it. Very
cancer.
sorry, that's one way to look at it. But because I remember that when it actually occurred, there was no smoking history, there was no other history, there was no fast food history, because I belonged to a very modest background, alhamdulillah. So it wasn't that that our mother would allow us to kind of go and have fast food every single. It was more of paratha and roti. So we still see that that there are cases, because now when I go to get my medicine, I do see that people who are actually from a very lower status of the community, unfortunately, are suffering from this illness more. Or
Yes.
probably because, you know, even when I come to Shifa hospital, even if I go to any other government hospital, what I do see is that, you know,
There is
that's
a
the
bulk
people
of
from
these
the lower
patients.
segment.
Exactly. The reason is the
So
the
then
educated people, they
correlating
come
it with
early.
fast food and all of that, I don't think that, you know, that can be
I
one
think
reason.
you know,
But
the
it can be, lifestyle can be one.
lifestyle is one of the things. Just as I told you, you know, there is no specific thing that you pinpoint to a patient with a blood cancer. This is the reason you got blood cancer.
True. Yeah,
This is
that's
true. You
not
know, this is the
happening.
world. You know, all over the world, the research is going on actually to point out. The only one thing that we can figure out, if there is something, you know, we have a targeted mutation available, we can give you a targeted therapy. Just like in your case, obviously, you must be advised a targeted therapy to target the mutation you had.
True.
So when we talk about mutation, these are the general risk factors we tell the patient. They all can lead to different kind of mutations. There are a lot of anyway, you know, we have radiation exposure all the time. Cell phones in our pocket, and we are surrounded by radiation.
Wi-Fi.
Exactly, but these are those things that still need to be researched and actually check their correlation with the patient of cancer.
Exactly.
So yes, that
Yeah,
is one
but-
field we all are working in actually at the moment.
Of course.
But
Sure, go ahead.
But you know, that is true that fortunately in Pakistan we do have a lot of targeted therapies and treatment available for all kind of cancers.
Alhamdulillah.
So you know, I think timely detection, coming on time, is actually a key to the treatment. The later you present, the worse is the outcome. And this is what I tell all the families as well. Keep regular screening. Do not take your symptoms lightly. If you have something going on, at least just get a simple CBC blood test done.
True.
Don't wait for over 6 months and over a year, then you are thinking, you know, I should just get a blood test done. Earlier you pick the things, the earlier it is treated, the earlier stages, they have a better outcome.
But Dr. Saiba, once it's diagnosed, and obviously like we mentioned that the cancer, the word cancer evokes such sort of scary
So if cancer is more of a
imagination.
stigmata, you know, I tell a
Exactly.
family you have a cancer, you know, young boy, 22
वो
year
हर
old.
फिल्म ड्रामे में बंदा मारना होता है,
Yeah,
कैंसर
exactly.
से
The
मार
family
देते
collapse there right in your clinic.
Right.
Oh my
Yeah.
God, we have a cancer. So yes, it's more of a stigmata. You know, it's not like, you know, all the cancers you would end up having your hair falling down and, you know, would be nausea,
So what
vomiting.
sort
It's not
of
like that.
supportive care do you think a person needs, especially when we talk about the blood cancer? Because like you mentioned, it is so much stigmatized and there's so much scare that is evoked when we talk about this cancer.
I think good counseling is very, very important on the
Okay.
part of physician as well.
Okay.
So being a physician, you know, I keep a half an hour for specifically for counseling of these new patients.
Okay.
They need to understand. See, if they are, you know, if you make the patient depressed on your first visit, you know, and you have a cancer, the family and everyone is at loss. So you have to tell them it's a completely treatable thing.
Right.
If you start treatment on time, you'll be up and about. And the results, you know, and outcome and what are the side effects. See, the more scary part is you don't know what's going to happen to you.
True.
So if I tell as a physician what your drug does, what will be the side effects, how long your treatment will be, and when we do you
What are
expect you
the
will
side
cure.
effects generally?
So mostly side effects, you know, depends on the chemo you are getting.
Right.
Generally, the oral tablets, they have lesser side effects. You mostly nausea, vomiting. You can have low blood count. You might have fever, but you know they are manageable things. Provided that you do remain in touch, you have timely blood transfusion if needed, and take medication on time. You know, it's a generally treatable. We don't need admission for all kind of
Yeah, and
cancers.
people stay a very, you know, people live a very healthier life, Haja.
So
know,
you
it's-
have one example sitting right in front of you. You know,
Alhamdulillah,
so
shukr,
they are,
alhamdulillah. I'm
alhamdulillah,
very
doing very
thankful to
well.
Allah Almighty. But you know, where you spoke about counseling, I still believe that, you know, my family did a wonderful job.
Family
so imagine
support
that,
is
you know,
utmost.
when they figured out that, you know, that there was something wrong with me, they didn't tell me. So it took me a week's time to realize what I was going through. And then eventually there was a doctor, you know, who came over to my place to tell me that, son, do you know about diabetes? And I was like, yes, I know about diabetes, you know, so people get it and all they have to do is just take this medicine throughout their life. He's like, that's all, you know, so that's all you need to do. I was like, okay, you know, that's wonderful. So I did my own, because what happened was when I figured it out, I went on to my laptop, and as soon as I opened up my laptop, I was like, is it curable? And the first result which comes up or pops up is, it's not curable. And I start to read it, it gives me a life expectancy of 45 days. And I was like, okay, Allah miya ko razi kar lo jaldi se, because, you know, you might be short on
So
time.
this is true.
Google
I
is-
tell all my patients, please do not Google your
Yeah.
disease. The Google will tell you you're going to die in few days.
True.
This has happened, you know, most of the youngsters, they all are school going or university going. They Google up the disease.
Right.
They come, they're extremely depressed
Yeah.
because Google tells them you're going to die.
Exactly.
And
And
this is going to happen.
Is it a contagious disease, Dr.
it's not.
Saiba?
No, it's not
And what are the
contagious.
risk factors?
You can have
involved?
babies, you can get married, you can have a healthier lifestyle, you can go to the gym, you live a
Please let
normal
the
life.
doctor know, right?
You live a
Some
normal
people
life. You know, I'm an
don't
example.
No, it's an example. It's a good thing, you know, he's sharing it. I personally believe in Pakistan, we need to have a cancer support group. Survivors of
Right.
cancer need to form a support group for the patients who are undergoing it. You know, more than a physician, the patients who are survivors themselves,
Right.
they are a big hope for the patients who are already undergoing treatment.
Exactly.
Right.
So I think we need to form a good platform and a forum where all the cancer survivor patients can share their stories
True.
and help the patients who are newly diagnosed, youngsters who are newly diagnosed, and guide them.
Exactly.
I think that would be a big support for all of them.
Yeah, and thank you so much for mentioning that, because I would love to mention over here if our audiences are listening out there. So I happen to be a friend of Shaukat Khanam. So, you know, there's a donation or charity box in my name. You can go onto their website and donate whenever you feel like. And it's a wonderful idea too as well, so that people can talk. Because what my parents had to do was to kind of figure out who other people were living with the same illness, and then go to them and ask them about how their life was. Now coming down towards treatments, you know, there are multiple treatments for younger people, for older people, so how, and there are variations to it as well.
So yes, we divide the treatment as per the age group and the patient's comorbidity. Younger patients, they have greater options of treatment from oral to IV, and they tolerate it better. The group, elderly age group, we have limited options. Obviously, it's adjusted. It's not treatable, yes, but we do give chemo which is less intense and which is more adjustable to their age and their comorbidities.
Yeah.
Other than that, we do have bone marrow transplant available for patients who do not respond to IV chemotherapy and other treatment. So bone marrow transplant also available, and there are lots of myths with bone marrow transplant as well.
Yeah.
So I would like to clear that as
Sure,
well.
go ahead.
So we do have patients coming up who are scared, their families wouldn't come, that you're going to take a bone marrow or bone or something and you're going to
It's
do a
just blood,
surgery
right?
and transplant.
Right.
And I tell them it's not true, it's not like that. So bone marrow transplant is basically, we have two basic different types, allogenic bone marrow transplant and we have autologous transplant. In autologous bone marrow transplant, we take blood donation from the patient himself from a special machine, apheresis. It's simple like a blood donation. We collect a bag of blood and stem cells basically in it, preserve it, give the patient chemotherapy and infuse his own cells back to him. This is autologous transplant. There is no surgery involved. Same goes for the allogenic, where we ask to have a donor. Donor is usually a family member, your own brother, sister, someone you know very close to your family. So there are two methods of collection. The peripheral blood stem cell collection is when we attach a cannula from your arm and collect a blood bag.
Right.
There is no harm to donor. Donor is not harmed even in long term. You just giving a blood donation. And you know those stem cells that we need, we collect them and we infuse to the patient.
Right.
The other option is the bone marrow harvest. Okay, that is even that is not harmful for the donor. We usually collect bone marrow aspirate. It's also a blood collection, but obviously we do it from the hip bone.
All right, and that's a little painful though.
We do it under anesthesia, so the donor doesn't know, obviously.
Obviously,
But
but you
yes,
know,
it
when
is
you
more
look at
of
the
an
needle, you're
invasive-
like, okay, I don't know what's going to happen to me.
Needle
It's a
is
long
always
needle,
scary, though,
unfortunately.
even small injection, you know.
And in addition to this, you know, while we are speaking of it, so obviously now there are multiple treatments. First of all, I would really want to thank, after Allah, I would really want to thank Punjab government, because they have been giving away free medication to the blood cancer patients, may it be Glyvac, may it be Tasigna. So because the medicine is really expensive for 1 month, you know, because it happens to be your oral chemotherapy. I think that's more forward way to put it. So thank you, you know, to the Punjab government, because it was under the auspices of the then Chief Minister Shahbaz Sharif Saab.
Right.
He understood that, you know, what sort of problems people were going through, and I'm really glad, because imagine that, you know, for 1 month's period, you know, you certainly have to pay 500 to 600,000 rupees to get 1 month's medicine. And so, you know, Punjab government giving it free to the people is something which was a blessing in disguise, and it was certainly a blessing in disguise, and it is, alhamdulillah, still, and it's an ongoing project. But now coming back to, when do you think that people who are actually on those medicines need to move on towards or thinking or start to think about bone marrow transplant? Because with bone marrow transplant, obviously the donor is safe. There's no problem with the donor. That's one thing that people need to understand. Either it's going to be your brother or your sister. You know, they're going to match it. You know, if it's an 80-90% match, you know, you're good to go. But with the person who's going to get that bone marrow transplant is at a higher risk. You know, so it's a 50-50. That's what most of the time people say.
Okay, so you know the patient who's getting the transplant done, that depends what kind of disease he has, what kind of disease indication we are transplanting him for. So we have bone marrow transplant for blood cancers, aplastic anemias, thalassemias. There are multiple conditions in which we are doing bone marrow transplant.
So for blood cancer
for leukemia, yes, bone marrow transplant depends. We are doing a full match transplant, we are doing a half match transplant. The result changes with that.
Okay.
So we do have an option, and we usually reserve it for the patients who do not respond to the chemotherapy. Usually first line, second line chemo, they do not respond. We give the family an option. We know after first line chemotherapy, the patient is not responding, he is a high risk, he is going to relapse, he is not doing well in chemo. Then we advise the family to do workup for transplant and, you know, proceed with that.
Okay, that's wonderful. But, you know, before we actually, because that's the most extreme treatment that you can get, and, you know, it's like 100% success. If it goes successful, it's 100% success, you'll be free. But there can be repercussions, so that will come to that. But now since I've mentioned about Glyvac and I've mentioned about Tasigna, that these oral chemotherapies which are available, do we have another generation available over here in Pakistan? Because I still remember that Glyvac I had for 7-8 years, and then my body built up an immunity,
then you were on
and then
Tasigna
there was a
probably.
relapse.
Yeah.
So then they moved me to Tasigna, and luckily alhamdulillah that it worked. It's not always that the same medicine will work for everybody.
So, the disease you have is different than acute leukemia. What you had is chronic leukemia. In chronic leukemias, we do have an option of oral chemotherapy like you are taking. And yes, we have first generation, second generation, even third generation TKIs available in Pakistan.
Okay, even third?
Yes, we do have third generation available by name of ponatinib. Right, so the patient who do have resistance to nilotinib, we shift them to ponatinib.
Okay.
And there are other medicine in the same group as well. So depending on the patient who are
I
not
don't think that you're going to get that for free, right?
So unfortunately, yes, we do not have free programs available for all of them. In Pakistan currently, yes, we have 2 programs running, and with the government changes and the political crisis going on, they keep on closing and restarting, which is a big issue for our patient. Majority of the patients are non-affording.
Exactly.
So the loss of treatment, loss to compliance with treatment is a big issue because they can't afford it.
Exactly. And for people who are actually on these medications now, this is more of technical for them to understand. So imagine we do see white blood cells, hemoglobin and everything. So there are these 4 components towards the end of your report. I think that's lymphocytes and something, or probably, I don't know, what do we call them? Those 4 components, what cell types, different cell types.
Yes, different cell types. Whenever you get a CBC differential thing, there are 3 things. You have a white cell count, TLC, you have hemoglobin, you have platelet counts.
Yep.
Right? So in cases of CML, what we monitor is the white cell count. We also see your peripheral blood film to see if there are any abnormal cells still there or they have normalized. Generally, when you are on treatment, your CBC becomes normal after a few months.
True.
And then we have a genetic mutation test.
Normocytic, normochromic, something definition. Yes.
Okay, yeah. Normochromic, normocytic means you have a normal CBC going on.
Yeah, exactly. So that's wonderful. Now, what I wanted to ask you over here was that, when is the time for people to understand that, God forbid, there might be a relapse by just looking at the CBC, that they really need to rush to the doctor right now?
So if you are a patient of CML taking oral chemotherapy, if your white cell counts are increasing rather than decreasing, they are static, they are not going down, your symptoms are not improving. Secondly, you get a specific PCR for BCR-ABL done. That is more important. Rather than CBC monitoring, we need a 3-month BCR-ABL testing, which actually tells us whether you are responding to this treatment or not.
Okay.
So if your BCR-ABL cutoff ratio is above, your doctor, physician is going to tell you, okay, this medicine is not working. They'll make sure whether you are compliant, even taking it timely or not. If not, then we do a check for different mutations.
True.
So if we find a specific mutation, we directly switch you to a 3rd line medication or switch you to another line.
Exactly. And very quickly towards the end, very sorry Hajraj, because I'm living through it. So very quickly, I think I would want you to kind of share this with people that, God forbid, if there's somebody who's just been diagnosed with any sort of blood cancer, they really need to be kept away from any sort of viruses and viral infections, because people over here in Pakistan certainly do not know these morals that even if you have flu, you're not supposed to shake hands with anybody else. True. So please go ahead and kind of emphasize on that please make sure that you stay away from that person.
So in the setup we are living in, when you find out that someone in your family is sick, instead of having less people around, you would have a whole village and everyone coming, and mama and chacha coming for that. So I get a lot of patients with leukemia whose counts are very, very low. With counts, I mean they have a very low white cell count. So whenever your patient who has a white cell count, he is predisposed to all kind of infections that you are not. For you, it might just be cough. For him, it might be ending up in ICU with an infection which we can't control. So I tell all the families as well that if you have a child is under treatment, he is getting chemotherapy, so his blood counts are going to remain on the lower side. We are giving a lot of protective medicines to these patients, antiviral, antifungal, so they do not get infection. So the families, I would request, when these patients are on these medications, please make sure you do not take them in public gatherings where people are coughing and having different infections, because you are exposing them to deadly infections. For them, they might be ending up with ICUs with those infections.
Exactly.
For you, it might just be a simple visit. You are having flu and cough. You are shaking hand with them, but these patients do not give you time.
True.
And once they end up in ICU, they have a very poor outcome because they are already having a very low immunity. They are already in chemotherapy with very low reserves. So the outcome for them is fatal then.
Right. Thank you so much, Dr. Saiba, for enlightening us and shedding the light on the blood cancer awareness. Thank you so much once again. And now we are moving on to a short break. And after we come back, we have a very interesting discussion.
We have another doctor.
lined up, yes, and that is too linked with the field of medicine in the first place. So don't go anywhere.
Good morning.
Welcome back, and before going on to the break, like Shahzad alluded to, that we have a very interesting conversation lined up, and that too about the field of medicine, because we are graced by someone who is sitting in our studio who has so many feathers to his cap. He is not just a doctor, he has secured 25 medals, out of which 23, pardon, and out of which 15 are gold medals. He's also simultaneously engaged in the extracurricular activities despite being a doctor, because the field of the doctor itself is so much time consuming, and it's a very difficult field to work in, especially when it comes to the academics. He's been involved in the cricketing, he's involved in the debating, he's a content writer, and apart from that, he's also a Hafiz-e-Quran. So we would like to ask that how come he has so many feathers in his cap, mashallah, mashallah, because obviously, like we mentioned, the field of medicine in itself is a very time consuming and it's a very hectic field.
And it's students like these, you know, who make the life of other students, you know, a little bit of troubling. You know, so ladies and gentlemen, without any further ado, we're very lucky. We have been joined by the pride of the country. Imagine that, you know, first of all, MBBS itself is very difficult, and then scoring 23 medals over the course of 5 years is something which is phenomenal, and it is extraordinary. So very quickly, without any further ado, we are very lucky that we've been joined by Dr. Hafiz Muhammad Hamza Waqar Sahab. Hello, assalamu alaikum, good morning. How are you feeling today?
Islam. How are you feeling?
We're feeling great. Thank you so much for asking a counter question. It feels wonderful when somebody asks us a question, okay? But Hamza, very quickly, I think I would want you to kind of start from your childhood, you know, what sort of a boy you were, you know, what sort of a kid you were, you know, how smart you were, and were you always about books, or was it always about extracurricular activities? So let's start from there.
I was born in Islamabad in a middle class family. I was too bright for a preschool education. I didn't require any preschool education.
I thought you were about to say I was too bright for a middle class family.
I was too bright for preschool education. I just got admitted into grade 1 directly, passed the admission test, and I never feel that I am lacking behind other students that I did not acquire any preschool education. Okay. I passed the primary education with the A1 grade and scholarship in federal board. Then I joined IMSB G64 for my higher secondary school education, and I passed that in A1 grade 2.
You know, so I would want to, you know, kind of you to share your marks with our audiences as well. So, for example, did you do matriculation or O levels?
Matriculation.
Matriculation. How much did you score?
93%.
93%. So, out of 850, you scored what?
970 out of 1100.
970 out of 1100.
1050.
Wow.
1050. 1050.
Yeah, 1050. So, now let's move on towards HSSC. So, what was your score?
I got 980 out of 1100.
980 out of 1100. तो बाकी भी बेटे क्यों छोड़ दिए थे, वो भी ले लेने थे. Okay, that's wonderful. So moving on then.
Then I joined Fazai Medical College, passed the entry test with good marks, and then at the top merit I got admission. And after joining Fazai Medical College,
very sorry, I'm going to stop you over here. But you know what happens is that, you know, when you have such a bright child at your house, what happens is that people are eyeing on, you know, public institutions to go to for medical studies. Why would you make your father or mother spend so much money on private medicine school? Why did you do that? Because you were already too bright, so you didn't get the merit in a public institution?
There were two reasons actually. First of all, I tried really hard, but I couldn't get admission at Arrival 20
So the merit was too high?
Because that was only medical college at my time in Twin Cities.
Okay.
So I got admission in Fazai Medical College that was nearby to my locality, and I had a passion that I should join Pakistani force. So it was actually.
Alhamdulillah. Wow, so that's wonderful. So now you got into the medical school. Then what did you do?
When I started in medical school, I was just aiming that I want to score good marks, but that was not the case. It was unexpected to me that you should do very hard. It is claiming more and more hard work from your side. And in the initial years, I was saying to my parents, why you have get me into this studies? I should go somewhere else, because it was claiming more and more hard work, and as a BD student, you expect from yourself more, that you should participate in extracurricular activities, you should score very good, but it was not as expected. So I was really disheartened at that time.
So
but
you did MBBS or BDS? MBBS, right?
MBBS.
Yeah, MBBS, thank God.
But as the time passes, you get to know about the medical education. Every new year comes with new challenges, new subjects. You get into the hospital, you take care of the patients. That feeling of actually goodness come, and that actually really inspired me.
I think it's a big relief for the patients to be like, you know, Hafiz sahab aa gaye na, Hafiz, Allah Hafiz.
And obviously, Shahzad, it's a very difficult task, especially doing the medicine, and there's so much pressure that you have to juggle with them. And I keep hearing a lot of stories that how people actually, students actually, they're unable to, sustain that pressure, and they break down, and then they go towards this drug addiction and whatnot. So how difficult was it to juggle between that pressure, academic studies, extracurricular?
Yes, you can say MBBS is another name for struggle and effort, because
यार ऐसे तो ना क्या बाकी भी सब काम ही कर रहे हैं.
the course is unlimited.
That's
You
true,
have
that's
no
true.
boundary.
That's
You have Gray's Anatomy of this thickness book, and you have to study that,
True.
and this is very difficult. So I actually coped up with this, that I set a small targets,
Okay.
not thinking too big that I should top. No, I will say I set the aim of I should top this test, then this block exam, then
So
this
shorter
year.
goals.
Shorter goals. And I always try to teach other students to help them, so it become easier for me then.
Exactly, and I always used to say that because whenever we used to do the combined studies, and while I was teaching other friends of mine, I would prepare myself better, So
Yes.
that's something
Yeah,
which I
that's
have
very
always
helpful.
realized.
That's very
Yes.
true. That's very helpful.
That's was
because
exactly the case in my
obviously, for teaching, you need to understand at
True,
first,
true,
right?
true.
And then you are better well equipped with the whatever the subject you are. So now let's tell us about your journey towards being in Hafiz Quran. So what pushed you towards this very learned and bright field?
Actually, I was 9 to 10 years old, a boy who had just passed a primary examination. My father called me and my younger brother that I wish one of two become Hafiz Quran. I actually was not taking into consideration that much, but he stacked up all the books of 6th class. He said, if you can learn by heart these all books in 1 year, then why can't you learn Quran in 1 year?
Your father's smart too.
I accepted this as a challenge, and I alhamdulillah completed Hifz Quran in 1.5 year, and till now I am reciting the Holy Quran in the Taraweeh from the last 14 years.
Wow, yeah, it's such a
Alhamdulillah,
blessing to have you over
that's-
here inside the studios, such amazing, talented, smart, wise individual.
And that's an inspiration, I would say, for a lot of other people. So you also invested in the poetry and reading and writing. So would you like to tell us about this inclination? So what sort of poets do you read, and what sort of poetry you are invested in, if you can recall some of the verses?
I was in class 3, and my teacher forced me to participate in a debate competition. I was not interested at all, but there was a culture in government schools that only intelligent students were preferred to go there. So that was actually changing moment of my life. That pushed me towards the arts and literature. At the age of, you can say 12 or 13 years, I was writing poetry just for them, and the inspiration was I read the poetry of Bahadur Shah Zafar and Mir Taqi Mir and Ahmad Faraz. I said, if they can write this poetry, why can't I do this?
Yeah.
So I started that, and now I am reading the Allama Iqbal, Mir Taqi Mir, and in the latest poets is Ali Zariun.
So can you share a few couplets of your poetry as well?
Yes.
Please go ahead.
I usually write in Urdu language, so it
Sure,
is
sure, go ahead.
खुद से किया हर वादा तोड़ देता हूँ, टूटी गलत फहमियों को फिर से जोड़ देता हूँ, क्या मसला है, कैसा मिजाज है मेरा, हर सीधे रास्ते को मोड़ देता हूँ.
Wow.
That's wonderful, and obviously when we talk about your
का
future
मसला तो है, ये
plans,
हर सीधे रास्ते को मोड़ है.
and
कोई सीधा भी
since
ठीक
you
जाना
are
चाहिए.
doing the masters in public health in the first place, so why do you choose this field of public health? Because this is a diversion from the MBBS, right? And if someone wants to follow in your footsteps, do you think that has a good scope in Pakistan?
And yeah, and please take us through, how you divided your time, because you were playing, you were debating, you were doing everything, any normal healthy child would do. You were learning, memorizing Quran by heart, you were progressing in your education. So every field, there must be some sort of discipline that you had in your life. So share that routine with us as well.
I do follow the fact that Allah has given you abilities. He actually gives you ability to divide the time too.
True.
So I actually, when it becomes your passion, extracurricular activities, cricket, debating, and badminton, all stuff. So you can take time out of it. So I was usually I usually chose public health, because public health is actually progressing in our country. It is prevention is better than cure, which is
Right.
not in the case in Pakistani people. So, and it can lead to make the health policies which are not very good in Pakistan, unfortunately.
Why would you say that? I think our state managed the COVID really well, and a lot of countries failed to understand that disease. I would say so. I think that is the bright feather in our cap as a state, because I don't believe that we are lagging that much behind.
I mean, he's still on his learning curve, so I think we must hear him.
Public health
yes.
actually progressed in Pakistan from the start of COVID. At that time, we realized that we have less public health consultants like other countries.
True.
So that was a climax point. Right. So from that one, there is a build of Health Services Academy in Pakistan, and I joined that, and I'm learning there.
Wow, it's wonderful. But what are your goals now? Because you're a smart gentleman. We do see that there's a weaker area over here in our country, that there's lack of research. So, we certainly have to rely on other allies to bring in that research. And, just like, for example, COVID vaccine, so obviously we're eyeing out that, okay, now we're going to have this vaccine eventually, that, Pakistan started to make it as well.
Right.
But how do you think that you can contribute in future towards the health of the entire population of Pakistan?
I'm aiming to become an ophthalmologist for now. But as ophthalmology is a clinical field and public health is a preventive field, so I joined both, so I can contribute better than others, because I know what are the problems coming in the clinical health, and then make policies for them. And when you read prevention more than the treatment, then it can lead to the benefit of the patient.
True.
So it was usually my.
But for somebody so smart, obviously they're eyeing out on a profession where they can earn a huge amount of money as well. So you've invested your time, you've worked out every single day. Do you think that being an ophthalmologist is something which can certainly give you what you want? In terms of, I'm very sorry, but that's very material perspective. But or do you think that because over here we do have a lot of people living with hypertension, anxiety, stress or disorders,
right.
neurological disorders. So why not something else rather than being an ophthalmologist?
Because ophthalmology treats the eye. So eye is a beautiful window to this beautiful world. Yeah. And as a doctor, you want patient satisfaction. If you are treating oncology, hematology, sorry to that, but the patients are treated very less. And there is a number of morbidities. So in eye, it is not the case. If you get cataract, we can treat it.
Window hi band hogi na.
Yes. If your vision is lost, then you can't
God
see
forbid,
anything.
we do not want anybody to lose their vision. But what I'm trying to say over here was that since you're too smart, I'm not trying to change what you have decided, your discourse of your future. But what I'm trying to convince you is that since you are a very smarter child, I think that you really need to kind of work on something which is very rare, because now you've highlighted it yourself that, okay, unfortunately with other illnesses, there's a higher failure chance. So why not, invest your time in somewhere where there's higher failure chance, and with your contribution, that failure is going to change into success. I think that's somewhere you really need to work, because we want smarter people to kind of go in those fields where we do not have a lot of people working day in, day out to make sure that there's going to be lesser failure and more of success. Do you think that we can talk about that?
Yes. In ophthalmology, actually, there are less number of people about corneal transplant and oculoplasty, which is a very common issue, that if you get trauma and your eyes are lost, then you can implant new eyes. So wow. I'm working upon that, and I have aimed to.
Hence, you have your younger brother doing optometry.
Yes.
So I think they're very well thought and well planned. And ladies and gentlemen, in life, that's how it needs to be. You really need to plan it ahead. And his younger brother is over here. He's recording his interview. It's wonderful to see how brothers are supporting each other, the entire family. So how was the entire setup within the family? So your mother, father, obviously you're going to be all support for you. But what about other cousins? यार कि हमजा तू तेरी वजह से हमें भी भाई नंबर ज्यादा लाने पड़ते हैं. So were you a tension for them, or were you that one of those cousins who would tell them, बेटे मैट्रिक है, तेरा रिजल्ट आ गया, तेरे इतने नंबर आए, something like that?
No, actually they all were supporting, because my cousins are actually good in studies. We have a good family, about good educated family, so everyone was supporting. One of my cousins complained once, but I make him understand that it is your problem, it is not my problem. I can help help you a lot in studies, but I
But if
have
you're not
set
performing, yeah, that's your problem.
I have set bigger aims in my life, and I have to achieve that.
And I think that's a very difficult question to answer in the first place. If someone is saying that, you know, because of you we are getting a lot of pressure and you need to perform well, but
वो डॉक्टर वकार के बेटे को देखो कितने अच्छे नंबर लेकर आया है. अब वो बाकी सब देख रहे हैं कि भाई अब्बू आपके कितने नंबर आते हैं, you know, what were you scoring? And you know, any parent you would ask, you would like, whenever they're going to tell you this, you know, look at their child, you know, he's performing or she's performing so well. Number one, there shouldn't be any comparison.
True.
But as soon as you ask your parents, हम तो फर्स्ट आते थे, अरे भाई सारे फर्स्ट आ रहे थे तो फेल कौन हो रहा था उस टाइम?
That's true, and thank you so much for pointing it out. But thank you so much, Dr. Waqar, for coming here and having this very interesting
And we are super proud of you. We are
Yes.
super proud of you.
Yes.
23 medals, that too in a course of 5 years. Hafiz-e-Quran, making sure that
Right.
you're going to debate, you're going to represent Pakistan, making sure that you're going to keep yourself healthy, life on track, having friends, going out with them. It's a very normal life and at the same time a very high achieving end life. When it actually kind of inspires a lot of people out there to do that, because if you can do that, anybody else can, right? Alhamdulillah.
Right, and with that we will say goodbye and Allah Hafiz and wrap up our segment, and once again thank our worthy guest for coming here. So until next time, it's a
1, 2, 3, good morning. Have a great day. Learn from Hamza.